Hello, my name is Kyle Gretel, and the topic I will be covering today is the vulnerabilities of the elderly during disaster situations. Disaster victims' ability to respond to the event depends upon a variety of factors. These factors can affect individuals differently depending upon their age. My presentation will focus on how the elderly are affected by disasters such as tornadoes, hurricanes, floods, and earthquakes. Much of the information that I will be presenting was found in the article titled "Frail Elderly as Disaster Victims: Emergency Management Strategies." The studies in the article focused on 5 different factors that increase the vulnerability of the elderly during a disaster. The factors include impaired physical mobility, diminished sensory awareness, pre-existing health conditions, and social and economic constraints. The first factor I will be discussing that affects the elderly ability to respond to disaster is their impaired physical mobility. The different types of physical mobility include impaired balance, decreased motor strength, poor exercise tolerance, and functional limitations, which can all be seen on the slide behind me. The ability to walk, travel outside the home, eat, use the telephone, and perform a variety of other activities decreases as age advances. In sudden onset disasters such as earthquakes and floods, the elderly physically may be unable to duck and cover, or quickly evacuate a building. All of these physical mobility factors inhibit the elderly to react the same way as a younger individual. Along with physical impairments, elderly individuals also experience diminished sensory awareness. The sense of vision, hearing, smell, taste, and touch diminish with age, and loss can be intensified by chronic disease. Night vision and peripheral vision cause serious difficulties for the elderly when they are in unfamiliar environments. Hearing impairment is the most common diminished sense in people greater than 75 years old. This may cause problems avoiding hazardous situations during the event and the disaster, and create difficulty in understanding emergency instructions in environments with excessive background noise. Another factor that inhibits the elderly during a disaster is the likelihood of pre-existing medical conditions and sensitivities. The probability of contracting multiple chronic diseases increases with age. Disaster compromised health resources, patients may find it difficult to effectively manage their own illnesses or chronic conditions. Not only are the elderly more likely to have chronic pre-disaster conditions, they also are prone to suffer health-related consequences as a direct result of a disaster and to require longer recovery periods for these problems. With being more likely to have chronic diseases and also prone to suffer injuries from disasters, the elderly are at a disadvantage during disasters. The elderly also suffer from social impairments, which further disadvantage them during a disaster. The elderly need a lot of social assistance during a disaster to help cope with the stress. Since the elderly are less likely to have close social relationships, they are more likely to experience stress. Elderly also receive less proportionate aid in the aftermath of a disaster than do their younger counterparts. All of these social disadvantages contribute to the vulnerability of the elderly in a disaster. The final factor affecting the elderly during a disaster is their financial vulnerability. The frail elderly can be more vulnerable to property damage due to lack of insurance, a smaller financial cushion, and poor credit worthiness due to fixed income and lack of employment. Elderly also have fewer opportunities and less ability to generate income, are increasingly reliant on social benefits, and are more likely to live near or at the poverty level than are non-elderly. All of these factors can be seen on the slide behind me. With so many financial vulnerabilities weighing down on the elderly, their ability to manage disaster situations diminish. As this presentation has detailed, it is clear that the elderly are more vulnerable during disasters than are other groups of the population. The factors that contribute to this are their impaired physical mobility, diminished sensory awareness, pre-existing health conditions, and social and economic constraints.